Hi, my name is Dr. Tori Hudson. I'm a naturopathic physician. I'm a member of Pharmaca's Integrative Health Advisory Board. I've been in practice for 28 years practicing women's health, and today I want to talk to you about vaginal infections. And these come in all sizes and shapes, but the three most common causes of infections are bacterial vaginosis, BV for short, yeast vaginitis, and trichomonas. And let's talk a little bit more about the yeast and the BV because those are the ones that women are most in the situation of maybe kind of self-treating. Now, BV is actually the most common of the vaginitis infections, and this comes with a discharge and an odor. Those are kind of the two keys. And yeast vaginitis is more a discharge and itching. So that right there, really, you've done a pretty good job of self-diagnosing, but not a perfect job. And if your symptoms don't respond, then you should see your doctor. But in terms of BV, we do have some over-the-counter natural agents that can be used to treat BV, and then there's some nifty little things to know with specialty prescriptions. So one of the things we want to know about the vagina is there are good bacteria that actually keep us from having infections, and these good bacteria are called lactobacilli. And there are different species of lactobacilli that dominate the vagina. Lactobacilli rhamnosus, reuteri, crispatus, some acidophilus, and in Pharmaca we have some vaginal specific probiotics, and they're mostly designed to be used orally, although they can be used vaginally as well. But this alone will probably not successfully treat a case of BV. We're going to need some boric acid suppositories. You tend to need to, depending on the state, I think, but you need a prescription for boric acid powder, and you can either capsule them yourself or a pharmacist would have to make suppositories per the directions of the physician. But there are also some natural agents beyond that in suppository form. There's one study on a vitamin C suppository, and Pharmaca actually has a product that I actually formulated that has a little boric acid, some vitamin C, some homeopathics that are in suppository form for the treatment of bacterial vaginosis. For yeast, boric acid again is quite successful, in fact very successful at treating yeast vaginitis. A study long ago, 98 out of 100 women were successfully treated with boric acid suppositories, and these women had chronic, unrelenting yeast vaginitis. But there are some, again, we want to consider these vaginal-specific lactobacilli species to repopulate and keep the vagina in a healthy state and keep the yeast and bacteria from overgrowing. But some antifungal vaginal delivery herbs as well, as Oregon grape, golden seal, tea tree, neem. These are found in some suppository form for use in intravaginal delivery. Orally, beyond the vaginal specific probiotics, maybe some of these candida products have garlic and caprylic acid and again, Oregon grape. Some of these things can be used if you're really struggling, having really chronic recurring yeast, maybe some of those oral antifungals as well. But the key is to try to really keep that area populated with the good bacteria, and that can be done with taking these oral specialty species. So I hope that's helpful for BV and yeast vaginitis.